Hi, I'm Frank Spear. I want to welcome you to this blog. We're now into our 7th portion on anterior temporization. And some of the things that we still haven't talked about yet are custom staining or custom shading of your temporaries. Now that may seem like kind of going a bit too far, but in reality there's a lot of times it's a necessity. If you're doing 1 or 2 teeth in an older patient, often none of the temporary materials look even close to their teeth, and I want the temporary to look pleasing enough so they're not self-conscious. In addition, you have some patients who may not want white teeth. They may want teeth that have a certain appearance to them, and I'm going to actually share with you one of those patients. This is a patient who had been in my practice for years and did not want his anterior teeth treated because he was afraid I would make them look too nice. And he was very serious about that. He's an artist and he didn't want straight white teeth. I had treated his wife with veneers and she was extremely happy and we made the teeth very pretty, but he was clear that's not what he wanted. He finally decided that he did need to do something with how they looked, but he said you have to make it so they still look like they're mine, not like they're part of everybody else who wants their teeth done. So the initial thing to do, of course, is to try and decide what shade should we make them. We're going to treat just the 4 anteriors, and it's kind of a multicolored approach. In other words, he's got a virtual shade guide across the anterior. And ultimately, he and I talked about it. He looked in a mirror, and we came with A3.5, which is pretty dark and pretty colorful. But he said, no, that's what I want. And some of his teeth were a little darker than that. Obviously, the right lateral was significantly lighter than that. Now, to be honest, I wasn't positive A3.5 is what he would want. He also didn't want them straight. He wanted them slightly malaligned. And so the malalignment was no problem. We had a diagnostic wax-up done that left the teeth slightly malaligned. But I actually made the temporary out of shade A2 temporary material, so he could see what it would look like if they were lighter in shade. Now, honestly, I knew A2 would be too bright, but I knew I could also stain it down fairly easily. And if I made it out of A3 temporary material, often those are not very pretty looking temporaries. Well, the bottom line is he hated the A2, hated it. So the good news is it's easy to stain temporaries. There's a lot of different products on the market. I'm just going to show you what I've used for probably the last at least 16 years. And that is a product from Kulzer called Palaseal, which was designed as a light cure denture sealant. And I'm going to mix with it some powdered porcelain stain. So when this photo was taken, when this patient was treated, I used a product from GC called Orbit Stain. That product's no longer available on the market, but your lab can give you porcelain stain. You just need powdered orange, powdered blue, and powdered white. And then you're going to mix it with the Palaseal in a dappen dish. And I'm going to show you a video in a minute of how to do it. Super simple because it won't set until you light cure it. So you can put on your stain, get it to where you want it. And here was that A2 temporary. And after a few minutes time, here's that same temporary, and literally by holding up an A3.5 shade tab, I could stain the temporary to literally match that A3.5 tab. Now I can try that back in, see if he likes it or not. If he likes it, I photograph the shade tab next to the temporary, and that's what goes to the lab as our shade photograph. Here is the A3.5 temporary in his mouth. In reality, it doesn't look too dark at all because of the shade of his lower anteriors and the shade of his cuspid, and in fact, he loved it. And so this is a case where staining the temporary was really a helpful tool, not just to make him happy while he's wearing the temporary, but also as a communication tool to him on what's possible for color and form, and also to the laboratory. We send this photo and a photo of the shade guide next to this temporary, and of course we send a model of the temporary to the lab. They can make a very simple putty matrix of that temporary, and it'll tell you exactly where the incisal edges should go of those final restorations to replicate the form of the temporary. And that's what he looked like pre-treatment. And again, his goal, not to have teeth that were too nice looking, not too straight, not too white, but much better than what he had, and he was very pleased with the final result. Now, just to walk you through actually doing it, here's a video of how we stain. We've got our orange stain powder and our blue. We put some clear Palaseal in one dish. We mix the orange with Palaseal. The orange will go on cervically, but before we do that, we aerabrade the whole temporary with aluminum oxide. And then once we put a clear coat on every tooth and cure it, so we put a clear coat on everything. Now I take my orange and I color the cervical and I color up the interproximals. So it defines the temporary more because it gives us some interproximal color. And then we go to blue, and the blue starts to intensify the look of translucency in the incisal. So we just put it up the interproximals and across the incisal edge. And then we come over all of that with clear. So it's one layer of clear, followed by the colored layers, cure it, another layer of clear, and I like to actually cure it for several minutes in an oven. I use a triad oven. There's many other ovens on the market that use halogen lights, one or two of them, and you end up with a very nice surface. Now I do polish it with pumice and Ivoclar polishing paste because to me Palaseal is too shiny. It also has kind of an oxygen inhibited layer on it. So I polish it, and this is what it looks like after you've polished it. You can see the color interproximally. You can see the blue. It's not overly done in this case, but that's a simple example of how we stain temporaries. And for a lot of cosmetic cases, it's not done, but for a lot of patients who are really looking to get natural looking teeth, I find staining a very helpful tool to test drive the color before I have the lab commit to it. So I hope you've enjoyed this part of the segment. One of the things we haven't done yet with anterior temporaries is adjust them in the mouth. Everything I've shown you so far is contouring them on the lab bench. But in the next segment, we'll talk about what happens if you actually need to make some adjustments to length or embrasure form in the mouth. It's nice to not take it out. So I'll look forward to seeing you there.